Hello, everyone. Welcome back to Health Angel Solutions. Today, we're going to discuss 5 things you should know if you've had your thyroid surgically removed, a procedure known as a thyroidectomy, or if you've had your thyroid radioactively ablated, which leaves the patient without a thyroid. My area of expertise is treating thyroid issues in patients. Let's get started on today's topic, which is 5 things you should know if you have had a thyroidectomy. I assist patients balance their hormones, and I also help people lose weight generally. I approach both of these issues from an integrated functional perspective. As previously stated, a thyroidectomy is the removal of the entire thyroid gland. Generally speaking, this is thought of as a surgical procedure. I have discovered that thyroid patients often lack knowledge about this condition, and having this information will help them understand what kind of treatment is best for them, why they are likely not feeling well, and other pertinent information. These are very important points to note. Before we get started, please scroll down, and if you haven't already, click the subscribe button if you're interested in those kinds of topics, because I think you'll find a lot of the information we discussed here interesting. All right, so the first thing I would say is probably the most important thing you should be aware of if you've had your thyroid removed through a thyroidectomy is that you are now functionally hypothyroid. I want to be clear about this so that it takes some time to sink in. I don't care why you've had your thyroid removed. I don't care if it was due to cancer. I don't care if it was because you had previously been hyperthyroid. If it's because you've had large thyroid nodules. That being said, once your thyroid is removed, you have effectively cured the hyperthyroidism that was a part of it, but you are now replacing it with hypothyroidism. I know this is kind of confusing for a lot of people because many people get their thyroid removed because they were hyperthyroid. All right, so after having your thyroid removed, you are now hypothyroid. All right, so I frequently receive this question. People will say, hey, thanks for writing this information about that. However, could you please ensure that it is tailored specifically to those without thyroids? I also want you to know that if I discuss hypothyroidism in any way, it applies to you even if you do not have a thyroid. All of the content, videos, and resources I have posted are relevant to you because you have hypothyroidism. Okay, this is a really significant deal, and I want to make sure you understand it. If you have any questions, please leave a comment below, and I'll assist explain. Once you really get the hang of it, it's actually fairly easy. However, I want to make sure you understand that number 1. Secondly, there are medical studies that demonstrate that T4 thyroid medication is insufficient if you have had your thyroid removed through a thyroidectomy. Let's break this down a little bit. You are prescribed medications like Level and Synthroid after having your thyroid removed. These are levothyroxine and Synthroid. Okay, and they contain only the T4 thyroid hormone. Most people may or may not be aware of this, and to be honest, it doesn't really matter. But allow me to describe this unit in detail. What researchers have done is take individuals who have had their thyroid removed and compare their thyroid function to individuals who have a functioning thyroid gland in their body, and they discovered something very intriguing, which is that even though you take thyroid medication after thyroid surgery to try and replace that lost hormone, it's never enough on its own if you're only using T4 to get you back to the normal, healthy levels that people have when their plans are working. This is a big deal. Now, the paper I'm quoting was published in the Journal of Endocrinology, which is one of the largest journals in the field of endocrinology, so it's not just a little podunk journal. This is a very significant study that demonstrated that T4 thyroid medication, or the level of thyroxine and Synthroid, is insufficient to optimize your thyroid levels if you have had your thyroid removed. Yes, it can be sufficient if you still have thyroid gland tissue in you. But after a thyroidectomy, the thyroid gland is removed, but is either non-functioning or absent. So Level and Tinsel alone will not be sufficient. This helps to explain why there are so many people out there, especially you, who are probably listening to this, and why you've experienced a lot of symptoms related to your thyroid, such as fatigue, low energy, hair loss, weight gain, and so forth. Number 3 is weight gain. More medical studies have shown that patients who have had their thyroid removed gain, on average, about 20 pounds. That's crazy, but people will gain 20 pounds after having their thyroid removed. What's interesting is that doctors will say, "Hey, I'm giving you T4." It's because you're probably not taking the right medication. They're two tired hormones. Synthroid only contains T4, and most people need T3 if they've had their thyroid removed. I have other videos on that topic that I highly recommend you watch. If you made it this far into the video, thank you. These videos take a lot of effort and time to make, so if you enjoyed them, please hit the like button, subscribe to the channel. This goes a long way in helping us grow. That said, back to the video. Your thyroid is normal once more, but you're still gaining weight. This is understandable, but they're trying to tell you that your thyroid is normal. But in fact, weight gain is a sign of hypothyroidism or a sluggish low thyroid, which is why we're back at the top. That being said, it's not the most crucial point to make. While it is true that 80% of people gain weight following thyroid removal, you should also be aware that losing weight will always be more challenging after thyroid removal. This brings us back to the 3 that I previously mentioned. If you're in the lucky 20% or the 1 in 5, it will be relatively easy. It won't be easy, but it won't be as hard. However, if you're in the unlucky 80%, which is the majority of you, you'll not only gain weight, but find it difficult to lose it. If you want to lose weight, take the appropriate prescription. I'll make a video especially for those who have either thyroid hormone, which is number 3. The fourth and most crucial point, which is something I see a lot of patients confused about, is whether you should take thyroid supplements or just supplements in general if you had your thyroid removed. I'm going to tell you that yes, you should take thyroid supplements. I know what you're thinking though. How can I take thyroid supplements if I don't have a thyroid? But that brings us back to the second point, which is basically the first one. Even though you're taking thyroid medication, there's a chance you're not even taking the correct kind of medication. You're taking levothyroxine due to the fact that, as you may recall, number 2 that we discussed is that, in addition to supplements that you can take, particularly the ones I have and other supplements, your body needs to take the T4 that is present in the medication and convert it into an activated form before you can use it in your cells. Zinc, selenium, etc. I suggest you view my video on thyroid supplements, since they can improve the efficiency of your thyroid medication, particularly the conversion of T4 to T3. Therefore, you should utilize drugs that increase the level of efficacy and send them to your body since they facilitate their absorption. Iodine is another medication that you should be aware of. Yes, iodine is still useful regardless of whether you have a thyroid or not. Skin and breast tissue, for example, still require iodine. Some say things like, "My doctor says I don't need iodine because I have my thyroid around." I don't even understand why they would say that, given that other cells in their body also require iodine and that humans aren't able to generate it. Because they require iodine, they must obtain it from somewhere else, so those are crucial. If you haven't already, you can look into some of the supplements I've recommended specifically for the thyroid. I have one that supports T40 through conversion booster or T4 to 3 conversion, which you can use in addition to levothyroxine or Synthroid, which can help you. Lastly, and this is just going to touch on something that you may or may not know, if you have had your thyroid removed, you will need to take thyroid medication for the remainder of your life. The reason for this is that your thyroid produces the hormones T4 and T3, which are vital for survival. If your thyroid has been removed, you will not be able to obtain these hormones from any other source, so you will need to take medication, levothyroxine, or Synthroid. This brings us back to the weight gain associated with T4. It is crucial that you take the proper type and dosage of thyroid medications if you wish to feel better. This usually entails taking T4 and T3, but it's important to realize that if you've had your thyroid removed, you will need to take medication for the rest of your life. The only exception to that is if you had radioactive iodine ablation, RAI, which only destroys a portion of the thyroid gland rather than the entire gland. The other situation, which is also true occasionally, involves patients who have had hemi-thyroidectomies, which remove half of the thyroid gland. In this case, you might not need to take medication, though I do believe those patients generally respond better to it. That covers the 5 things that I believe anyone who has had thyroid surgery should be aware of. And keep in mind that this also applies to individuals who have undergone radioactive iodine ablation, so technically, even those who have had end-stage Hashimoto's disease. I would like to hear from you all if you have experienced any difficulties with these 5 items. Please tell me specifically. If you have any questions about the first item, that you are hypothyroid, please leave a comment below, and I will try to address them. Incorporating a balanced diet, staying on top of your medication, and being mindful of how your body reacts are all critical steps in maintaining your well-being. It's also essential to keep open communication with your healthcare provider to ensure you're on the best possible path. If you or someone you know is facing life without a thyroid, remember that you're not alone. There are communities, resources, and professionals ready to support you every step of the way. Don't hesitate to reach out and seek the support you need. Thank you for joining us on Health Angel Solutions. We are committed to bringing you accurate and helpful content to support your health journey. If you found this video helpful, please give it a thumbs up, share it with others who might benefit, and don't forget to subscribe to our channel. By subscribing, you'll stay updated on all our latest videos, ensuring you have access to the knowledge and tools you need to live your healthiest life. Stay well, and we'll see you in the next video.